Antoinette, what services does Broward Health North Memory Disorder Center offer to the community, and how can the audience access these services?
Well, the Broad Health North Memory Center has been in existence for over 30 years. And one of the things that we're very proud of is the services that we offer to our community. Some of these services are, we do a free memory screening, and this is not just for patients that come in to see the neurologist, but patients throughout the community. Sometimes we go to the centers and conduct those screenings, as well as persons can call and set an appointment with our social worker to have those screenings done. We also offer a care assistance program, and this is a 12-hour training where we train caregivers to take care of patients with Alzheimer's or dementia. It's like from the A to Z about caregiving. And those classes are offered throughout the year as well. We have a support group that we have on Mondays from 10:30 a.m. to 12 p.m., except on holidays, like public holidays. And most recently, we added an educational component for those support group training, where we offer an hour and a half or hour to hour and a half of different topics as it relates to caregivers. And last but not least, one of the other things that we offer is that we actually have 2 social workers that are full-time at the center. So we offer counseling to patients as well as people outside of the hospital setting or the office setting, to the community as well. So if anyone needs any advice or resources, that's available to anyone that calls. How you can contact the Memory Center is by dialing our contact number, 954-786-7392, and anyone in the office will be able to help you and connect you with some of those services.
All right, thank you, Antoinette. Next question is for Mr. Brody. Michael, what is the difference between Medicaid assistance for nursing homes and for assisted living?
Thank you for the question. So, first of all, assisted living has gotten very expensive recently. And that is really because in the time of COVID, and since then with the labor shortage, those people who were paid inadequately 5 years ago are now at least paid 20% more than inadequately. On the other hand, the effect of that has been for people who are looking for assisted living that they have to pay much more money. The key factor here is that there are literally 2 systems that Medicaid uses to help people pay for long-term care. Nothing works on independent living, but in nursing homes, the state will cover your long-term care if you qualify for Medicaid. And you've heard today the qualifications, pretty much no money and limited amount of income. On the other hand, in assisted living, which is a residential platform that has nursing services, the state will help you pay the bill. They won't take over the bill for you, they won't take your Social Security, but they will help you pay the bill, typically to the tune of about $1,500 per month. That may not be enough when assisted living often costs $4,500 a month and sometimes more, but it covers the gap sometimes.
Thank you, Michael. Katrina, what can a senior center offer to assist caregivers and their loved ones? Katrina, among other things, operates the senior centers in the city of Miramar.
Good afternoon. Thank you, Tim.
Sure.
So the Social Services Department in the city of Miramar, we are responsible for our 2 senior centers. And one of the things, and I've heard it on this stage several times today, that the Senior Center offers is the socialization component. We've got tons of really great activities, but one of the things that's really important is that we can connect you to people that are like you, that you can learn from, that you can spend time with. We have breakfast every day. We're a congregate meal site as well for lunch. We have 2 locations. If you're a caregiver and you have a family member that is still independent, this is a perfect setting for them. They go on excursions on a regular basis. They just went to, I believe they went to Panama. There's planning a trip now to New York.
There you go.
I can't even keep up with them. They literally are into something all the time. They have activities and events every single solitary day. Not just your everyday, we're not your center's bingo. We have, and I think that's funny, we have on a weekly basis, we have a very robust health and wellness program, because we know as we age that it's important that we maintain our strength and balance. We have 4 social workers on staff that are available. They run groups, and they also provide individual counseling. Those services are also available to caregivers if it's needed. I could go on all afternoon, so I think I'm going to stop it right there, because I could talk about our senior center forever.
All right, thank you. You'll get another opportunity to talk about your senior centers in a minute. Irma Diaz, she's the owner-operator of Home Watch Caregivers of Southwest Broward. Irma, how do home health services fit into the continuum of care for individuals with dementia and Alzheimer's?
Thank you, Tim. And good afternoon to all of you. Buenas tardes, ¿cómo están? The continuum of care fits in perfectly because from the initial diagnosis all the way to the treatments that are needed, even though to long-term care, providers like myself, a home care agency, we're able there to be able to assist you. For an example, if somebody gets diagnosed or is getting discharged from a hospital, they need some assistance when before they were very independent and they might need some temporary short-term or even long-term support, they will reach out to an agency like myself. And from the moment they get discharged, we review all the documents together with the independent person, the individual or their family members to prepare a care plan. From that care plan, we're able to assist in putting things together for them. So one, we can send an aide home to assist them with any assistance at home, or even work together with a skilled nursing facility or anybody else that can assist them together, being able to work together. Thank you.
All right, thank you. All right, back to Antoinette on your right. What should one expect on their first visit with the neurologist at Broward Health North Memory Disorder Center? What should they expect on that first visit?
Well, I must say, apart from meeting an amazing team and staff, that's your initial that you'll expect when you walked in. One of the things that we do for a patient that's coming in for a new patient to be, evaluated for memory loss, what you can expect, the initial visit can be a little lengthy because there's a few things that we have to get in place. The first thing that the patient will go through is that screening, if they weren't done as a community screen before, with our social worker. That can take 30 to 40 minutes depending on, the patient and how fast they can go through the series of questions. After that, they'll meet the nurse who goes over like the history, medication management, making sure that we do all our screens. Then the next person you'll see is the physician, the neurologist, who's gonna review all the data and the information that the team gathers. And from there, we'll initiate the plan of care. And that could be ordering various kind of tests that requires the patient to come back at another time to go over those results. And that's where kind of you get that diagnosis, if you're having a dementia or Alzheimer's, or if it's just mild cognitive impairment. But it's very important that that first phase gets carried through, because one of the things that I see very often is after they come, then the follow-up, then 2 years later, they're coming back again, didn't do what was ordered 2 years before. One of the things we highly encourage is that any patient that's coming for that evaluation must come with a caregiver or a family member, because it's hard when you have memory loss and you come to those appointments alone. We try our best to hold our patients' hands throughout the process, but that's something that we can, kind of help to prevent if you have someone coming with them initially. Now, future visits, depending on what the patient needs, is continuous, but at least for the first visit, I would say it's a little lengthy because of those things that needs to be in place.
All right, thank you. Thank you very much. All right, back to Mike Brody. What is the cost for independent living, assisted living, memory care, and nursing homes? What does that ballpark cost?
So let me take a step back from that question, and I will answer it very easily at the end, aside from saying it's expensive. Just a quick summary. Does anybody here receive assisted living services or provide assisted living services in the audience? Okay, and you take care of? Okay, excellent. Excellent. She's in assisted living or she's at home? Okay, how many people take care of people at home? Okay. You all provide assisted living. Okay, it's a very generic term. If you have home care, you are also getting assisted living. Frankly, if you're a mother with children, okay, who are taking care of an elderly parent, you're providing assisted living out of both sides of your existence. Sometimes assisted living is not paid for. Now, the formal assisted living that I work with is a paid-for program. But most assisted living in this country is covered by family and spouses, and sometimes other relatives, or home care. People don't typically move into a community. Most assisted living is done at home. Okay, and I think that's very important. Assisted living differentiates from nursing home because it's a residential base rather than an institutional base. What's the difference between residential and institutional? You may think not much, but nursing homes document every single thing that happened to you and are entirely responsible for your welfare. Assisted livings have an agreement with you that they will do some things for themselves and you will help them where they need help. Kind of like probably what most of you are doing in your own homes. And that's a big difference between the two. Let me now go back to that cost. So just so that you understand what it is, independent living typically costs somewhere between $3,000 and up. And it changes depending on if you have a studio apartment, a one-bedroom apartment, or a two-bedroom apartment and a den, and depending on the location. Some locations are more expensive than others. Assisted living typically is about $1,000 more expensive than that, okay, unless it's memory care, okay, in which case it can be $2,000 or $3,000 more. But assisted living also charges you for level of care, so if you need much more care, the cost will rise accordingly because they're using more of those expensive staff that I talked about before. Okay? So assisted living really would run from about $4,000 up to, in the most luxurious communities and in larger apartments, up to about $10,000 per month. Nursing home costs run at today, and it's hard for me to keep track of them, they've gone up so quickly. Nursing home costs today run $12,000 up to $15,000 and more per month. Okay. Okay, that gives you some idea of what the costs are.
Thank you. Yes.
All senior placement agencies get paid by the communities, not by you. And as senior placement agents, I have a contract with all assisted living communities, and they will pay if under the appropriate conditions. Obviously, you have to move in, but you have to be the first referral, and you have to not be on Medicaid long-term care programming.
All right, any other questions? Please, just you don't have to hold them till the end. Yes, in the back. I'm not sure of that.
Nursing homes, long-term care, the long-term care, not the rehabilitation side of nursing homes, which get reimbursed mostly by Medicare, but the long-term care side of nursing homes where they're taking care of people for their whole lives, typically is well over 90% indigent. And by the description, when I say indigent, I mean people who are being paid for by Medicaid. Only about 10% of long-term nursing home patients, residents, are covered by private pay.
All right. Thank you. All right, Katrina, what are some of the differences between adult daycare and a senior center?
Okay, so one of the things we have to think about when we hear the word independent a lot. So what does that actually really mean? A person who is independent is someone who can perform their ADLs unassisted. That is typically what you will find in a senior center because they have to be able to get around on their own. If they're forgetful, they can't be a wanderer. So a senior center is really for an adult, 60 or over, who's able to handle all of their ADLs on their own. In our adult daycare, what we have, our model is what is called a social model. So we're not a memory care center, right? There are patients that, or clients that would come that we would not be able to provide them the level of care that they need. However, if you have a loved one who might be a little bit forgetful and you don't want to leave them alone for the day, but they want to get out of the house and engage in activities, because our adult daycare actually has very robust, we have an activities coordinator whose sole responsibility is to make sure that there are activities available to seniors and any of our clients, because we actually take in our adult daycare 18 and over. They don't have to be a senior, they just have to be 18 years of age and older and need some supervision. Our activities coordinator spends her time finding activities to make sure that we keep those seniors engaged, that we are addressing some of the things that their caregivers, because they do have care plans, that their caregivers say may need assistance. We partner with local universities to provide internship opportunities for occupational therapy students, nursing students, and I think the most important thing to take away from this discussion is that an adult daycare is, in the model that we have, and not a medical model because there are different types, is really to provide an opportunity for the clients to go to a place where they get that socialization, they get some exercise, they're able to commune, play games, listen to music, learn different things. We actually have a pet therapy program as well. So pet comes in every other week. We have music therapy. It's an opportunity for a caregiver to place their loved one in a spot where they know they're going to receive what they need. They're going to get a little bit of extra care and supervision so that they're safe throughout the day. Additionally, our adult daycare provides a caregiver support. It's the second Saturday of every month, and we have an educational component as well. We recently provided first aid and CPR training for all of our caregivers free of charge. So it's just an opportunity for a caregiver to find a place to put their loved one where they know they have the supervision that they need, but they can still engage in great activities. And then the senior center is for that independent senior who really just wants to come and have a good time. You can come and go as you please. It's not a secure facility. You come in on the bus in the morning and you think that you want to go off and do something with your friends in an Uber, you just let us know and you can leave. Adult daycare is a little bit different. You're checked in the morning by your caregiver or the transportation service that brought you, and you're only released to that person. It's licensed by ACA. So our adult daycare is a licensed facility that provides that care, whereas our senior centers is really just a great place to have a really good time. And I see my people out there, they'll tell you, come on over, because it's a lot of fun.
There you go. There's the fan club. Thank you, Katrina. Irma, what are the specific benefits of home health services for caregivers of individuals with dementia or Alzheimer's?
Thank you again, Tim. I just want to differentiate. Some people get confused when they hear home health services. There are two different ones. You have the skilled nursing side, and then you have the home care side, which is the one that we provide. Many of the benefits that we have, but one very important benefit that we have for caregivers is that we give them that respite support, that needed time for them to be able to go do all the things that they may not be able to do on a daily basis because they are doing something that's very important in their lives, which is taking care of the loved ones. By us able to provide that respite care, we do send an aide to the house. We may send an aide to the house to provide maybe short-term hours, anytime between 2, 3, 4 hours, maybe a week, maybe per day. As long as it is short-term, that will be more of the respite care that we need, that we provide to the caregivers itself. A lot of the people ask me, well, if I just need a couple of hours as respite for myself, well, what is the pay for that? Well, there's many ways that you can pay. You have the private pay side, you have the Medicaid side, and also we also receive through the VA benefit side, long-term care side, any of those programs allow you as a caregiver to receive that respite, needed support, and also be comfortable when you leave the home that you are receiving care for your loved one by somebody, by an agency that is licensed, and an agency that is able to provide your loved one with somebody that is trained to take care of them.
All right, thank you. Thank you, Irma. All right, back to Antoinette. What criteria does a patient need to meet to be considered a candidate for Leqembi infusion? Leqembi, is that right? Okay.
So there are several criteria that has to come into play. I know Dr. Moskowitz spoke earlier about treatment advances in Alzheimer's. Leqembi or lecanemab is the only FDA-approved drug for the treatment of early-stage Alzheimer's. So it moved from a clinical trial, and now this is a drug that's treated, that you're using to treat. So one of the things that I always encourage as caregivers or family members, early detection is key. This drug treats Alzheimer's in the early stage. So if you're bringing your loved ones later on when the disease is too advanced, there's not much that that treatment will not really be applicable to that patient or individual. And some of the criteria, as I mentioned before, is that screening that I mentioned, the mini-mental screening. There are certain numbers that they have to be in, which means the earliest stage of it. And that is one of the things that we try to encourage everyone when we go to health fairs, that early detection is key, because now there is something out there to treat patients. Now, lecanemab is not for every patient, but for the patients that qualify, one of the things that they have to go through is that first visit and the second visit for the diagnosis. Once you get a diagnosis, you meet those criteria, we have PET scans or they do LPs. There's certain amyloids that has to be present on the MRIs or in the spinal fluid. And once that's positive and the neurologist deems that individual a perfect candidate for the drug, then they can proceed with getting the infusion. So first step is getting connected to a neurologist's office. If it's not the memory center, find a neurologist that you can work with, and once you're a candidate, then they'll send you to that path. Right now, we are doing the infusion at Broad Health North, not inside the memory center, but it's done in the outpatient setting. So once you have a diagnosis and you meet those criteria, the neurologist and the team will make that next recommendation.
All right, thank you. Michael, what is some guidance that you would give our audience today on selecting a facility for a loved one?
I think the first guide that I would say is select the right facility, not the cheapest one, not the most expensive one. And let me try to explain that. You want to be very practical about this. These communities have wonderful social advantages of access and advantages of services. I mean, you basically get, even in independent living, you get transportation, activities, security, housekeeping, and 2 meals a day. And if you elevate that to assisted living, it goes to 3 meals a day, plus assistance with bathing, dressing, medication administration, supervision of doctor's appointments, and redirection and behavior management if you're in or close to a memory care situation. So there are going to be different people who need different things. If you are in need of assisted living services and you decide you're going to go to an independent living community, I will tell you that you may not fit in well. Because guess what? Your neighbors and friends that you're going to be sitting next to in activities are going to say, I didn't really get to this age just to have to take care of you. Not necessarily nice, not necessarily welcoming, but you do find that. So the right place is probably more important than anything else. If you have some memory issues and are actually in what we call an elopement risk, you might actually walk out the door, you are not well served in a community that doesn't have a secured entrance. Because the moment you step out of the door, everyone's going to have a fit, and they're going to assign you with a 24-hour person to sit on your shoulder to make sure you don't do that again. Because nobody wants to be responsible for you crossing the street in front of a car. So it's the right place that makes the most sense for people. Okay, and then when it comes to money, it's the place that is not going to put stress on them financially. There's a difference between a person who is 90 years old, who has enough money for 10 years of care, and a person who is 70 years old, who has enough money for 10 years of care. You kind of want to take that 70-year-old and stretch that 10 years into 20 years. So it's complicated, it's individual, but that's my advice.
Thank you. Thank you, Michael. Katrina, what is the criteria for your daycare center in the city of Miramar?
So the City of Miramar's adult daycare, which is a part of the South Central Southeast Focal Point, requires that the person be 18 years of age or older, not 60. We actually had a client one time who didn't meet the criteria for our typical client, because we think of adult daycare as something for older adults, but ours actually takes 18 and older. They just need to have some supervision. One of the things that's important, and I mentioned it earlier, is that every person who needs supervision may not be a good fit for the adult daycare services that we provide. We are a social model, not a medical model, so there are some clients whose needs are outpace our ability to provide the level of care that they need. So it's very important that you find a place that can provide the care that your particular loved one needs. And then we do have some funding from the wonderful AAABC to provide care to clients. We take long-term care, and we do have private pay clients, and I believe we actually have some CCE clients as well, which is community care. Other than that, there's no other requirement. They just have to come in, go through the assessment, and then we find place for them. And we do have room right now, and I'm finding from my colleagues here at this wonderful conference that a lot of us do have space to take additional clients. So you give us a call at 954-889-2719. Shameless plug.
All right, yep, there it is. Okay, thank you. Thank you so much, Katrina. Irma, how do home health services contribute to the well-being of individuals with dementia and Alzheimer's?
Home care provides personalized care at home, and basically anywhere where you call home. We're able to assist anybody that needs that help residential. It could be at an assisted living facility. It could be they're traveling from one place to another and they need, they're in a hotel room and they need that short-term care. That's the area that we're able to provide. We can go anywhere. We can go anywhere that helps, but at the end of the day is to be able to provide them that support for, one, the caregiver yourself, be able to attend what you need to do, but the individual themselves to be able to have that support, that assistance that they may need for any of the daily activities that is missing during the day, during that time for them, okay, while still providing them to feel independent. Because that's what we realize is very crucial in the home care side. Many people are afraid to go ahead and have an aide go in and assist them at their home because you're going to lose your independency, and you do not. That is not what we want. What we're there for is, I always say, and I make it very easy, we're your eyes, we're your hands, we are that support, we're that companion to be able to assist you from the beginning to how long you may need us, the individual itself. But at the same time, we're also there to be able to offer support to the caregiver through other providers, through all the networks that I meet, that can provide some education. We can also provide the education of much needed assistance of how to do X, Y, Z to their loved one. Let's say due to the Alzheimer's already, they're bed bound and they need some assistance, some training to bathe them correctly, right? Or to maybe just change them because they cannot afford all those long-term hours of home care or any other services. We're able to educate and train them in that area too. At the end, our goal as a home care agency is to be able to provide that holistic approach, and that approach that not only for the individual, for the caregiver, for the families, the loved ones that also need that support.
All right, thank you. Now, this question I'm gonna put out to the whole panel here. What are some of the services or educational opportunities, training opportunities, and even respite that may be available to caregivers who are under a lot of duress and stress? You wanna? I know the lifting becomes an issue, and I think Broward Health North used to do a training on that. Do they still provide that?
No, they don't.
No.
I think what we focus really is the caregiver training, as I mentioned earlier, where we provide a 12-hour training for the caregivers, and we do that throughout the year. Our next training is in July of this year, and it's called Day Cap, because we do it in the daytime to capture some of those caregivers who are available in the day. And then later on in the year, or in the fall, we have the Night Cap for those who have to work and then come to the program. So, yes.
All right. Anyone want to add to that?
Well, you can get respite in assisted living. I'm not a wild fan of it. Sometimes you can get support from I think you can get support from the AAA for that. But whether you pay it or it's paid for you, I'm not a wild fan of respite even in assisted living because it's dislocating. And I'd much rather see, frankly, people stay at home and get a lot of care at home if that's feasible. Sometimes it's not. Okay, in which case, then I would reverse that and say, yes, it's good if you have to, but for a short period of time, it's a tough move. Moving is difficult. Okay, so I'd never advocate moving unless it's really necessary.
Repeating what I said before, from the home care side, the much needed respite that a caregiver may need is definitely through that assistance from somebody coming to your home, somebody that you can trust, somebody that you know that is going to take care of your loved one, never as you do, but definitely as close as possible. Through the home care side, there are a lot of support through the Medicaid programs. We have a lot of clients that receive Medicaid respite care for their loved ones. Through the VA program, we also have what we call also the respite care for the caregivers. So those programs out there, if you know of anybody as a veteran, right, and I speak very highly about that one, that is something that can definitely be used at home for the individual itself, for the caregiver itself. Through the VA program, they have the respite care, they have the home health services, they have community services out there. They outsource people like me, like my agency, to be able to provide that. But through that outsourcing, we are background check. They're very particular how they choose their providers that go into their veterans' homes. Those services are out there. Medicaid is out there. And also, if you start looking at information, like let's say even the ADRC right here, you can go in and try to get information through them. You can actually get information through other foundations in Broward County that do provide that care. Respite care is there. It is there. And again, one of the things that I do a lot is I'm always in the community. I'm always talking and meeting to people. So I always offer my services, saying if you have any questions, if you have, and you need additional information that maybe home care might not be your need at this moment, I love to do that. That's where I come in. So again, I'm going to throw that one in. Home Watch Caregivers, Home Care Agency, 954-645-2945, if you need any information. Thank you.
All right, thank you very much. Last question, and again, I open it to the entire panel here, and this comes up all too frequently. What are some common strategies when family members, typically sometimes the adult children, have different points of view on caring for an elderly parent without causing any kind of family divide? What are some of those strategies?
I'd kind of like to take that one, and it does depend on where that family member is in their memory journey. But early on, one of the things that I believe is the most important thing to do is to make sure that you engage that family member and ask them what they want. I can't tell you how many times a family will show up and say that mom or dad needs X, Y, and Z. And they give me this long speech about mom and dad's habits and whatever they're doing or not doing and what they need and what they don't need. And I look at that person and I say, well, what is it that you want? 9 times out of 10, it's like no one's ever asked me that. So I think the most important thing is to just have the conversation. And just because you're saying things that maybe your loved one doesn't want to hear, it doesn't mean they're not receiving it. We all sometimes have to accept things that aren't quite what we want it to be. However, just have the conversation, because it also helps maintain their sense of control. I heard you, I don't like it, but okay, as opposed to this is what you're doing, whether you like it or not. So I think just giving them the respect to ask them what they want and give them the space to express how they really feel, and then have the conversation about what has to happen next.
All right. Anyone?
Yeah. This conference is about caregiver empowerment. So the second person after that primary person that you're taking care of, that you really want to empower, is the primary caregiver. When you have families of caregivers, first of all, let's assume that they're not all going to agree on exactly the same thing. That's actually quite a rare thing. But the primary caregiver, that person who is providing care day in, day out, every hour, every day, no breaks for Christmas, no breaks for New Year's, no breaks for Passover, whatever it might be. That's the person that you have to support. And the other member, and I've talked to other members of the family and said, you're out of town, okay? Or you've been estranged from mom for 20 years, okay? Your job is to support the primary caregiver. Now that might be respite. Give them a break, okay? But that's definitely going to be, take over something that's finite. You can take over the finances. You can be the person who calls the doctor, but give the primary caregiver that support and the love and appreciation that they really need to do their job better.
Excellent. Well said. Anyone else want to add to that, please?
You want to
Another way that another strategy we could use in ensuring that everybody's on the same page is kind of give them an opportunity to get together. We've had to have, sometimes they come with the son today, then the next day they come with the daughter, and then you get a phone call from someone that's, of another state that says they don't know what's going on. And then when you realize the dynamics between all three is the issue and not really what's going on with the patient. So a lot of times we have to pay a referee and try to see, identify that one person that we can, talk to, and also be there to kind of listen, because it's not just about taking care of the patients and ordering a test. And at the Memory Center, we do a lot of social work, even though I'm not a social worker, but the job requires a lot of listening and connecting the dots. So sometimes you have to listen to not what's being said, but assess the situation and then intervene, because that intervention is going to make it easier for everybody to come together. And I think that's one of the key things that we have to do as caregivers: listen to, assess the situation, and see what's the real issue at hand.
I want to just add on and chime in to exactly what they were saying when it comes to empowering the primary caregiver. But one of the things that I have noticed a lot, and I deal with that a lot, I have a lot of families who are out of state. I have siblings. There's like 2, 3, one lives in one place, one lives in the other one, and the one is here at home. The one that carries the most of the daily activities is the one that is home. So what I have noticed, and that has helped a lot, is education, right? Is being able to educate not only the primary caregiver, but also assist to educate the primary caregiver, but also educate those siblings outside of what they are imagining should be happening at home versus what actually does happen, what's happening at home. Because that's the part, and I've noticed that a lot of times what happens is that the people who are outside the state or away or not able to attend to the loved one on a daily basis, sometimes it's very either a guilt or uncomfortable position because they're not there. So they start seeing things how that they perfectly want things to happen. But when I have the opportunity to be able to sit and talk with each one of them and maybe bring them together and allowing them to talk, and also, like you said, listen to the individual self who's receiving the caregiver, you start seeing more of a change of coming together, because at the end of the day, is they all want what's best for the person that we're taking care of, which is their loved one.
Please,
Yes,
the
ma'am.
floor is everyone's. Question.
Hello, I'm Regina, last name is Plaza, but I want to say that this has really empowered me today. I'm glad I came, and everything that you said, I've experienced it. I have been the primary caregiver for my mom for several years now, and although she has living sisters and a living brother, no one has come yet to see her, okay? Even when I lost my husband, no one came to help me. But in all of that, I still had to do what I had to do for my mom, you know, and I'm so thankful that God has given me the strength to be that child, because I have siblings and they're now coming, praise God, they're now coming to see mom, because it's coming, she's in the purple stage, she's in severe, so it's coming to the end. But God is preparing me that I was able to sustain this and then prepare them in a sense to where I do like FaceTime all the time to show them how mom is looking, how mom is doing. And they all applaud me with that. They say, oh, Regina, you're doing a great job. So they feel like since I got control of it and I'm doing it to my best ability, that they don't have to come, because they see like she's got it under control. So why should we come? And I was angry for a while, but then I had to release the anger and let it go and trust God in the process. But thank you all. This has been very informative, and I've been very empowered today to move forward and help others that are dealing with it now with their loved ones. And so thank you. It's been very encouraging.
Any other questions from the audience? Yes.
We have a question.
Yep. Got a few of them.
Besides the new drug that I'm going to have to figure out how to pronounce, but I'll work on that. I know the old drug was Aricept. Is there any other drugs they're using for like the onset of dementia, like the early onset, that they also utilize? Because I'm kind of like out of sync with some of the medications.
There are lots of different options out there, but as I would divert those answers to the neurologist who is prescribing those medicines, because not every drug is for every patient. You know, some patients have other comorbidities, hypertension, dementia, and certain drugs you can't combine with other drugs that you're taking. So to answer that question, there are different ways that you can treat the disease, but that's primarily a decision from the neurologist or the primary care doctor that's treating the patient, which one is the best one to use.
Do you have any idea how many they're up to now? Because I just remember Aricept from what I had dealt with, and then this new one, I just wonder how many are really out there now. Anybody know? Is it okay? Aricept, yeah, that's a very old
That was
one.
a big one. There's a question in the center here. Thank you.
Good afternoon. I keep hearing dementia and Alzheimer's. What is the difference?
Alzheimer's is a type of dementia, so it's related. It's kind of hard to explain.
Alzheimer's causes dementia. Dementia doesn't cause Alzheimer's.
Right.
So dementia is really the symptom. It can come from Alzheimer's, or it can come from various other diseases and conditions.
Right.
So is dementia a disease?
No, it's a condition.
Any other questions? Yes, we have one right there. Right in front of you. There you go.
I appreciate your comment that you just made about distinguishing between Alzheimer's and dementia, but if I recall earlier on one of the slides, I thought Alzheimer's was under the dementia umbrella, because you have Lewy body dementia, frontal temporal whatever dementia. So I think you reversed it. I think dementia Alzheimer's is under dementia. Now, I could be wrong. I don't know if anyone's. So, yeah. So dementia is under that. I recall seeing that on the umbrella, I thought.
That is correct. That is correct. So dementia, the condition itself, then you have the Alzheimer's, you have people that have Parkinson also has dementia. So yes, you have that, and you are correct.
Again this afternoon, and please help me give the panel a round of applause.